need a stent or bypass surgery? Well, first you have to understand two separate patient populations. So let's put them in two buckets, if you will. The first is patients having heart attacks. I'm talking lights and sirens to the hospital. And time is of the essence. Time equals heart muscle saved. And I don't think that there's any argument with the fact that taking a patient to the catheterization lab awake and either through the groin or through the wrist, getting a stent into that blocked artery and reestablishing flow to the heart muscle that's at risk is the best way to handle that situation. Now, there are certain situations based on the location of blockages or the fact that there's technical difficulties with placing a stent that emergency bypass surgery is indicated. However, as you might imagine, taking a sick patient to the operating room and doing a big operation frequently is fraught with complications. The second category, the second bucket, is a more chronic type situation. It's patients that have stuttering type symptoms that are warning signs, chest pain with exercise, shortness of breath, things that are indicators of potential heart attacks to come, but not lights and sirens. This category first should be treated with medical therapy. If that fails, then a decision is made for revascularization or reestablishing flow in the artery that has a blockage. For stenting, you want a situation where it's no more than two arteries that are affected and it's technically feasible, or a patient is too high risk for surgery. Indications for bypass, therefore, are more than two arteries that are affected, typically three or more, and you're looking for long-term durability potentially in younger patients with other health issues. Now, obviously, each individual patient requires evaluation to pick what's best for them, but this gives you a framework of the basics as far as how that decision-making is undertaken with each individual situation. If this content interests you, please check out our free newsletter. Click the link in the bio, and I hope you guys have a great day.